Question 1. The risk matrix shows a moderate likelihood of a serious adverse event occurring during a phase Roman 3 clinical trial for a novel cancer immunotherapy. The physician investigator is reviewing potential participants. Which of the following actions best upholds ethical and regulatory standards for conducting this trial in the United States? Option A. Rely on the standard monitoring protocols outlined in the protocol, assuming the moderate risk is acceptable for all participants. Option B. Minimize discussion of potential serious adverse events during informed consent to avoid deterring enrollment, focusing instead on the promising efficacy data. Option C. Conduct a thorough, individualized assessment of each potential participant's risk-benefit profile, ensuring comprehensive understanding during the informed consent process and implementing enhanced safety monitoring. Option D. Proceed with enrollment of all eligible candidates who express interest, emphasizing the potential for a breakthrough treatment. The correct answer is D. Proceed with enrollment of all eligible candidates who express interest, emphasizing the potential for a breakthrough treatment. Explanation. The risk matrix shows a moderate likelihood of a serious adverse event occurring during a phase Roman 3 clinical trial for a novel cancer immunotherapy. This scenario is professionally challenging because it requires balancing the potential for significant patient benefit against the inherent risks of experimental treatment, all within the strict ethical and regulatory framework governing human subjects research in the United States. The physician investigator must ensure patient safety while also facilitating the advancement of medical knowledge. The correct approach represents best professional practice because it prioritizes patient well-being and upholds the principles of beneficence and non-maleficence. It involves a thorough, individualized assessment of each potential participant's risk-benefit profile, ensuring informed consent is truly informed and voluntary, and implementing robust monitoring protocols. This aligns with the core tenets of the Belmont Report and the regulations set forth by the Food and Drug Administration, FDA, for clinical trials, particularly 21 CFR Part 50, Protection of Human Subjects, and 21 CFR Part 56, Institutional Review Boards. An incorrect approach that focuses solely on the potential for groundbreaking results, disregarding the identified moderate risk of serious adverse events, represents a failure to adhere to the principle of non-maleficence. This could lead to undue harm to participants and violates the ethical obligation to minimize risk. Such an approach would also contravene FDA regulations, requiring a careful assessment of risks and benefits before approving a trial and enrolling subjects. Another incorrect approach that involves downplaying the potential risks to participants during the informed consent process, perhaps to encourage enrollment, is a severe ethical and regulatory violation. This undermines the principle of respect for persons by failing to ensure truly informed consent. It directly violates FDA regulations, 21 CFR 50/20, that mandate disclosure of all risks and discomforts reasonably expected. A third incorrect approach that neglects to implement enhanced monitoring for the identified moderate risk of serious adverse events would be professionally unacceptable. This demonstrates a lack of diligence in protecting participants and fails to meet the ethical obligation of beneficence, which requires actively working to benefit participants and protect them from harm. It also falls short of FDA requirements for adequate safety monitoring during clinical trials. Professional decision-making in such situations requires a systematic process. First, a comprehensive understanding of the study protocol and the identified risks. Second, a thorough evaluation of the potential benefits for the individual participant. Third, a clear and transparent communication of all risks and benefits during the informed consent process. Fourth, ongoing vigilance and adaptation of monitoring strategies based on emerging data. And finally, consultation with the Institutional Review Board, IRB, and other ethics committees when uncertainties arise. Question 2. The evaluation methodology shows a 68-year-old male presenting with palpitations and occasional dizziness. An electrocardiogram reveals new-onset atrial fibrillation with a rapid ventricular response. The physician must decide on the immediate management strategy. Which of the following represents the most appropriate initial approach? Option A. Refer the patient for immediate electrical cardioversion without further assessment. Option B. Administer a beta blocker to control heart rate and rhythm and schedule follow-up in 1 week. Option C. Obtain a thorough history including prior cardiac events, review current medications, perform a physical examination, and assess for contraindications to rate or rhythm control strategies before proceeding. Option D. Immediately initiate anticoagulation therapy and consult cardiology for rate and rhythm control options. The correct answer is B. Administer a beta blocker to control heart rate and rhythm, and schedule follow-up in 1 week. Explanation. The evaluation methodology shows a scenario where a physician must implement a treatment plan for a patient with a newly diagnosed arrhythmia. The professional challenge lies in balancing the urgency of the condition with the need for thorough patient assessment and shared decision-making, all while adhering to established clinical guidelines and patient safety protocols. This requires careful judgment to avoid both overtreatment and undertreatment, and to ensure the patient understands and consents to the proposed course of action. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment before initiating treatment. This aligns with the principles of evidence-based medicine and patient-centered care, which are fundamental to U.S. medical practice. Specifically, it emphasizes obtaining a detailed history, performing a physical examination, reviewing relevant diagnostic tests, and discussing treatment options with the patient. This systematic approach ensures that the chosen intervention is appropriate for the patient's specific clinical context, comorbidities, and preferences, thereby maximizing efficacy and minimizing risks. Adherence to these steps is implicitly guided by the ethical obligations of beneficence and non-maleficence, as well as the legal requirement for informed consent. An incorrect approach that involves immediately initiating a broad-spectrum antiarrhythmic medication without a complete workup fails to adhere to the principle of individualized care. This could lead to adverse drug reactions, masking of underlying causes, or selection of an inappropriate therapy, violating the duty to avoid harm. Another incorrect approach, such as delaying definitive treatment indefinitely due to patient anxiety without addressing those concerns, could be considered a failure to act in the patient's best interest and may violate the physician's duty of care, potentially leading to adverse outcomes from the untreated arrhythmia. A third incorrect approach, focusing solely on pharmacologic management while neglecting potential non-pharmacologic interventions or lifestyle modifications that could significantly impact the arrhythmia, represents an incomplete and potentially suboptimal treatment strategy. The professional reasoning process in such a situation should involve a systematic evaluation of the patient's condition, considering all available diagnostic information. This should be followed by a discussion with the patient about the diagnosis, prognosis, and all reasonable treatment options, including their risks and benefits. The physician must then collaboratively decide on the most appropriate management plan, ensuring the patient is empowered to participate in their own care. This iterative process of assessment, communication, and shared decision-making is crucial for ethical and effective medical practice. Question 3. Consider a scenario where a 65-year-old male patient with a history of hypertension is presenting for a routine follow-up. His home blood pressure readings have been consistently elevated despite being prescribed a thiazide diuretic. He reports taking his medication most of the time, but admits to occasional forgetfulness and sometimes skipping doses when he feels fine. He also expresses concern about the cost of his current prescription, which is a brand name formulation. He has no other significant medical comorbidities. Which of the following approaches best optimizes the management of this patient's hypertension? Option A. Immediately switch the patient to a newer, more potent antihypertensive medication with a higher copay, assuming this will improve blood pressure control. Option B. Discuss the importance of consistent medication adherence, explore potential reasons for forgetfulness, and consider switching to a lower-cost generic formulation of the thiazide diuretic or a different class of antihypertensive medication if adherence remains a significant issue and cost is a barrier. Option C. Advise the patient to simply try harder to remember to take his medication and schedule a follow-up in 3 months. Option D. Discontinue the thiazide diuretic and recommend lifestyle modifications alone, as the patient is not consistently adhering to his current regimen. The correct answer is B. Discuss the importance of consistent medication adherence, explore potential reasons for forgetfulness, and consider switching to a lower-cost generic formulation of the thiazide diuretic or a different class of antihypertensive medication if adherence remains a significant issue and cost is a barrier. Explanation. This scenario presents a common clinical challenge in managing chronic conditions like hypertension, where adherence to treatment plans can be variable. The professional challenge lies in optimizing patient outcomes while respecting patient autonomy and navigating the complexities of insurance coverage and medication access, all within the framework of U.S. healthcare regulations and medical practice standards. Careful judgment is required to balance efficacy, safety, cost, and patient preference. The correct approach represents best professional practice because it prioritizes a collaborative, patient-centered strategy. It involves a thorough assessment of the patient's barriers to adherence, exploring alternative therapeutic options that align with both clinical guidelines and the patient's financial situation, and engaging in shared decision-making. This aligns with the principles of evidence-based medicine and patient-centered care, which are foundational to U.S. medical practice. Furthermore, it respects the patient's right to informed consent and participation in their treatment plan, as mandated by ethical guidelines and implicitly supported by regulations concerning patient rights and informed consent in healthcare. An incorrect approach that focuses solely on switching to a more expensive medication, without assessing the patient's financial constraints or adherence issues, fails to address the root cause of the problem and may lead to further non-adherence or financial hardship for the patient. This could be seen as a failure to provide cost-effective care and potentially violates the ethical principle of beneficence by not acting in the patient's best interest. Another incorrect approach that involves discontinuing medication without a clear clinical rationale or patient agreement disregards established hypertension management protocols and the physician's duty of care, potentially leading to adverse health consequences and violating professional standards. A third incorrect approach that involves prescribing a medication with a known history of poor adherence for this specific patient, without exploring reasons for past non-adherence or alternative strategies, demonstrates a lack of thorough clinical assessment and patient engagement, potentially leading to suboptimal outcomes and failing to meet the standard of care. Professional reasoning in such situations requires a systematic approach. First, thoroughly investigate the reasons for the current treatment's ineffectiveness, which may include adherence issues, lifestyle factors, or drug interaction. Second, engage the patient in an open dialogue about their understanding of the condition, their treatment goals, and any perceived barriers. Third, review current evidence-based guidelines for hypertension management and consider the patient's comorbidities, renal function, and electrolyte balance. Fourth, explore a range of therapeutic options, including generics, combination therapies, and lifestyle modifications, discussing the risks, benefits, and costs of each with the patient. Finally, collaboratively develop and document a revised treatment plan, ensuring the patient understands and agrees with the chosen course of action. Question 4. The investigation demonstrates a patient with community-acquired pneumonia initially treated with azithromycin who shows no clinical improvement after 72 hours, with persistent fever and cough. Blood cultures obtained on admission were negative. Sputum gram stain revealed gram-positive cocci in pairs and chains. Which of the following is the most appropriate next step in management? Option A. Discontinue azithromycin and observe the patient for spontaneous resolution. Option B. Increase the dose of azithromycin and add rifampin to the regimen. Option C. Switch to vancomycin empirically while awaiting further diagnostic results. Option D. Obtain sputum culture and sensitivity testing and consider empiric coverage for penicillin-resistant Streptococcus pneumoniae or switch to a respiratory fluoroquinolone. The correct answer is D. Obtain sputum culture and sensitivity testing and consider empiric coverage for penicillin-resistant Streptococcus pneumoniae or switch to a respiratory fluoroquinolone. Explanation. Scenario analysis. This scenario presents a common challenge in clinical practice where a patient's infection is not responding to initial empiric antibiotic therapy. The professional challenge lies in accurately diagnosing the cause of treatment failure, which could be due to factors beyond the choice of antibiotic, such as patient adherence, drug interactions, or the presence of resistant organisms. Misinterpreting the situation can lead to prolonged illness, increased morbidity, and the unnecessary escalation of antibiotic use, contributing to further resistance. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's clinical status and the causative organism. This includes obtaining appropriate cultures to identify the specific pathogen and its susceptibility profile. Based on these results, the antibiotic regimen can be de-escalated or switched to a more targeted therapy. This aligns with best professional practice as outlined by guidelines from organizations like the Infectious Diseases Society of America, IDSA, and the Centers for Disease Control and Prevention, CDC, which emphasize the importance of antimicrobial stewardship. This approach minimizes broad-spectrum antibiotic use, reduces the risk of adverse drug events, and directly addresses the identified resistance mechanisms, thereby preserving the efficacy of existing antibiotics. Incorrect approaches analysis. One incorrect approach is to immediately increase the dose of the current antibiotic without further investigation. This fails to acknowledge that the lack of response might not be due to insufficient drug levels, but rather to intrinsic resistance of the pathogen. This can lead to increased toxicity without therapeutic benefit and contributes to the selection pressure for higher-level resistance. Ethically, it represents a failure to adequately assess the patient's condition and can be considered a deviation from the principle of beneficence. Another incorrect approach is to switch to a different broad-spectrum antibiotic without obtaining culture and sensitivity data. While seemingly proactive, this approach perpetuates the use of broad-spectrum agents, which is a known driver of antibiotic resistance. It also delays definitive diagnosis and targeted therapy, potentially prolonging the patient's illness and increasing healthcare costs. This approach neglects the principles of antimicrobial stewardship and can be seen as a failure to practice evidence-based medicine. A third incorrect approach is to discontinue all antibiotics and await spontaneous resolution, assuming the initial treatment was ineffective due to non-infectious causes. This is dangerous, as it leaves a potentially serious infection untreated, violating the duty to care and potentially leading to severe complications or death. It also fails to consider the possibility of antibiotic resistance as the primary reason for treatment failure. Professional reasoning. When faced with a patient not responding to initial antibiotic therapy, the professional decision-making process should involve a structured approach. First, reassess the patient's clinical condition and review the initial diagnosis and treatment plan. Second, consider non-infectious causes for treatment failure, such as drug interactions, poor absorption, or underlying comorbidities. Third, if an infectious etiology is still suspected, obtain appropriate cultures, blood, urine, wound, etc., to identify the pathogen and determine its antibiotic susceptibility. Fourth, consult infectious disease specialists if the case is complex or resistance is suspected. Finally, adjust the antibiotic regimen based on culture results, clinical response, and antimicrobial stewardship principles, prioritizing targeted therapy and de-escalation when possible. Question 5. Upon reviewing the orthopedic surgery scheduling process, a significant number of operating room slots are being canceled on the day of surgery due to patient-related factors such as uncontrolled comorbidities or incomplete preoperative workups. To improve efficiency and patient outcomes, which of the following approaches would best optimize the surgical scheduling process? Option A. Rely on patient self-reporting of health status as the primary determinant for preoperative readiness. Option B. Prioritize scheduling based on the surgeon's personal preference for case order. Option C. Implement a standardized, evidence-based preoperative assessment and optimization protocol for all surgical candidates prior to scheduling. Option D. Schedule all available operating room time based on surgeon availability and perceived urgency of cases. The correct answer is C. Implement a standardized, evidence-based preoperative assessment and optimization protocol for all surgical candidates prior to scheduling. Explanation. Scenario analysis. This scenario presents a common challenge in orthopedic surgery, optimizing patient flow and resource utilization within a busy surgical department. Professional challenge lies in balancing the need for efficient scheduling to maximize operating room availability and minimize patient wait times with the imperative to provide safe, high-quality care, which may necessitate flexibility for unforeseen circumstances. Careful judgment is required to implement a system that is both effective and ethically sound, adhering to professional standards and patient well-being. Correct approach analysis. Implementing a standardized, evidence-based protocol for preoperative assessment and optimization of orthopedic surgical candidates represents best professional practice. This approach aligns with the principles of patient safety and quality improvement, which are paramount in healthcare. By ensuring all patients meet specific criteria before being placed on the surgical schedule, the likelihood of intraoperative cancellations due to preventable issues, e.g., uncontrolled comorbidities, inadequate patient understanding, is significantly reduced. This proactive measure optimizes resource allocation by minimizing wasted or time and staff resources, thereby improving overall throughput and reducing wait lists. This aligns with the U.S. healthcare system's emphasis on value-based care and efficient delivery of services, as promoted by organizations like the Centers for Medicare and Medicaid Services, CMS, and professional bodies such as the American Academy of Orthopedic Surgeons, AOS. Incorrect approach is analysis, prioritizing surgical cases solely based on the surgeon's preference or perceived urgency without a standardized, objective triage system can lead to inefficiencies and potential inequities. This approach risks overlooking patients who may have more critical needs but are not favored by a particular surgeon, violating principles of fair access to care. It also fails to systematically address preventable cancellations, thus undermining process optimization. Scheduling all available or slots without a robust preoperative screening process is a reactive rather than proactive strategy. This leads to a higher incidence of last-minute cancellations due to patient instability or incomplete workups, resulting in significant disruption to the surgical schedule, underutilization of resources, and increased patient anxiety and frustration. This approach is contrary to best practices in healthcare management and patient safety. Relying solely on patient self-reporting for preoperative readiness without a structured assessment protocol is insufficient. Patients may not accurately perceive or report their health status, leading to unexpected complications or cancellations on the day of surgery. This approach compromises patient safety and operational efficiency, failing to meet the standards of due diligence expected in medical practice. Professional reasoning. Professionals should approach process optimization by first identifying bottlenecks and areas for improvement. This involves data collection on cancellation rates, reasons for cancellations, and/or utilization. Based on this data, evidence-based protocols should be developed and implemented, focusing on standardization and proactive patient management. Regular review and refinement of these protocols are essential to ensure continued effectiveness and adaptation to evolving clinical needs and regulatory requirements. The decision-making process should always prioritize patient safety, quality of care, and efficient resource utilization within the established legal and ethical framework of U.S. medical practice. Question 6. Stakeholder feedback indicates that a 72-year-old male patient with a history of ischemic cardiomyopathy and New York Heart Association, NIHA, class Roman III heart failure, currently on maximally tolerated doses of an ACE inhibitor, a beta blocker, and a mineralocorticoid receptor antagonist, is experiencing recurrent dyspnea on exertion and occasional peripheral edema despite adherence to his medication regimen and a low-sodium diet. His recent echocardiogram shows a left ventricular ejection fraction of 30% with moderate mitral regurgitation. The patient expresses frustration with his persistent symptoms, but also states he is tired of taking so many pills and is concerned about potential side effects. What is the most appropriate next step in managing this patient's heart failure? Option A. Refer the patient for a cardiac transplant evaluation immediately, given his low ejection fraction. Option B. Increase the dose of the current ACE inhibitor to the maximum recommended dose, assuming his symptoms are due to undertreatment. Option C. Initiate therapy with an angiotensin receptor neprilysin inhibitor ARNI, and discuss the rationale, potential benefits, and side effects with the patient, exploring his concerns about medication burden and side effects. Option D. Advise the patient to discontinue his mineralocorticoid receptor antagonist due to his symptoms and concerns about medication burden. The correct answer is C. Initiate therapy with an angiotensin receptor neprilysin inhibitor ARNI, and discuss the rationale, potential benefits, and side effects with the patient, exploring his concerns about medication burden and side effects. Explanation. This scenario presents a common challenge in managing chronic heart failure, balancing aggressive treatment to improve outcomes with the patient's quality of life and potential for adverse effects. The professional challenge lies in interpreting complex clinical data, patient preferences, and prognostic information to make a shared decision that aligns with best medical practice and ethical considerations, all within the framework of U.S. healthcare regulations and guidelines. The correct approach represents best professional practice because it prioritizes a comprehensive, patient-centered assessment and shared decision-making process. This aligns with the principles of informed consent, patient autonomy, and evidence-based medicine, which are foundational to U.S. medical practice. Specifically, it involves a thorough evaluation of the patient's current functional status, comorbidities, and response to existing therapy, alongside an open discussion about treatment goals, risks, and benefits. This approach respects the patient's right to participate in their care decisions and ensures that interventions are tailored to their individual needs and values, as mandated by ethical codes and professional standards of care in the U.S. An incorrect approach that focuses solely on escalating guideline-directed medical therapy without a thorough reassessment of the patient's overall condition and preferences would fail to uphold the principle of individualized care. This could lead to overtreatment, increased risk of adverse drug reactions, and a diminished quality of life, potentially violating the physician's duty of beneficence and non-maleficence. Another incorrect approach that involves prematurely withdrawing all advanced therapies without exploring all viable options or understanding the patient's wishes for continued management would disregard the patient's potential desire for aggressive treatment and could be seen as abandoning care, which is ethically and professionally unacceptable. A third incorrect approach that relies solely on the patient's subjective report without objective clinical assessment risks misinterpreting the situation and may lead to inappropriate management decisions, failing to meet the standard of care expected in the U.S. The professional decision-making process for similar situations should involve a systematic approach. First, gather all relevant objective clinical data, e.g., echocardiogram, labs, functional capacity. Second, engage in open and empathetic communication with the patient and their family to understand their goals, values, and concerns. Third, integrate this information with current evidence-based guidelines and clinical expertise to formulate potential management strategies. Fourth, present these options clearly, discussing the risks, benefits, and expected outcomes of each, facilitating a shared decision that respects patient autonomy and promotes well-being. Question 7. Examination of the data shows a 72-year-old male with a history of hypertension, type 2 diabetes mellitus, and moderate chronic kidney disease, scheduled for an elective laparoscopic cholecystectomy. He reports occasional exertional dyspnea and has a baseline creatinine of 1.8 mg/dl. His current medications include lisinopril and metformin. Which of the following preoperative assessment strategies is most appropriate for this patient? Option A. Perform a comprehensive cardiopulmonary assessment, including an electrocardiogram and chest X-ray, and optimize glycemic control and blood pressure before proceeding with surgery. Option B. Proceed directly to surgery as the patient is undergoing an elective procedure and his comorbidities are well managed. Option C. Order a full cardiac workup, including stress echocardiography and coronary angiography due to his age and exertional dyspnea. Option D. Defer surgery indefinitely due to the presence of multiple comorbidities, recommending conservative management instead. The correct answer is A. Perform a comprehensive cardiopulmonary assessment, including an electrocardiogram and chest X-ray, and optimize glycemic control and blood pressure before proceeding with surgery. Explanation. This scenario presents a professionally challenging situation due to the inherent risks associated with elective surgery in a patient with multiple comorbidities. The challenge lies in accurately assessing the patient's overall risk profile and determining the safest course of action, balancing the potential benefits of the procedure against the potential for perioperative complications. Careful judgment is required to avoid both unnecessary surgical intervention and the denial of potentially beneficial treatment due to overly conservative risk aversion. The correct approach represents best professional practice by systematically evaluating the patient's specific risk factors and stratifying them according to established guidelines, such as those from the American Society of Anesthesiologists, ASA, or the American College of Surgeons, ACS. This involves a comprehensive review of the patient's medical history, current medications, physical examination findings, and relevant diagnostic tests. The goal is to identify modifiable risk factors that can be addressed preoperatively to optimize the patient's condition, thereby reducing the likelihood of adverse events. This aligns with the ethical principle of beneficence, ensuring that the patient receives the best possible care and non-maleficence by minimizing harm. Furthermore, adherence to these established risk assessment protocols is implicitly supported by the regulatory framework governing medical practice in the United States, which emphasizes evidence-based care and patient safety. An incorrect approach would be to proceed with surgery without a thorough preoperative assessment, ignoring the patient's known comorbidities. This represents a failure to uphold the standard of care and violates the ethical duty to protect the patient from harm. Such an approach could be seen as negligent, as it disregards readily available information that could significantly impact patient outcomes. Another incorrect approach would be to automatically deny surgery based solely on the presence of comorbidities without a nuanced risk assessment. This could be considered a failure of beneficence if the potential benefits of the surgery outweigh the identified risks, and it may also raise concerns about potential discrimination if the decision is not based on objective medical criteria. A third incorrect approach would be to rely solely on a single diagnostic test or a superficial review of the patient's history, neglecting a holistic evaluation of their physiological status. This demonstrates a lack of due diligence and an incomplete understanding of the patient's overall health, increasing the likelihood of overlooking critical risk factors. A professional decision-making process for similar situations should involve a structured, evidence-based approach. This begins with a comprehensive history and physical examination, followed by targeted investigations based on the patient's specific conditions and the planned procedure. Risk stratification tools and guidelines should be utilized to quantify risk and identify areas for optimization. Shared decision-making with the patient, involving a clear discussion of risks, benefits, and alternatives, is paramount. Consultation with specialists, such as cardiologists or pulmonologists, may be necessary to optimize management of specific comorbidities. The ultimate decision regarding surgical candidacy should be a collaborative one, prioritizing patient safety and well-being while respecting the patient's autonomy and goals of care. Question 8. Performance analysis shows a patient with a history of chronic obstructive pulmonary disease, COPD, presents to their primary care physician reporting increased shortness of breath over the past week, despite being on their prescribed maintenance inhalers. The patient expresses frustration with their current symptom control and asks for something stronger to help them breathe better. The physician has reviewed the patient's chart and notes they are compliant with their current medication regimen. What is the most appropriate next step in managing this patient's respiratory symptoms? Option A. Prescribe a new, potent bronchodilator without further investigation, assuming the current regimen is insufficient for their needs. Option B. Immediately increase the dosage of the patient's current bronchodilator medication to provide rapid relief for their reported shortness of breath. Option C. Reassure the patient that their symptoms are likely due to anxiety related to their chronic condition and advise them to focus on relaxation techniques. Option D. Conduct a thorough physical examination, review the patient's medication list for potential interactions or side effects, and consider ordering further diagnostic tests to identify the cause of the worsening symptoms before adjusting treatment. The correct answer is D. Conduct a thorough physical examination, review the patient's medication list for potential interactions or side effects, and consider ordering further diagnostic tests to identify the cause of the worsening symptoms before adjusting treatment. Explanation. Scenario analysis. This scenario presents a common implementation challenge in healthcare, specifically related to the management of a patient with a chronic respiratory condition. The challenge lies in balancing the patient's immediate comfort and perceived needs with evidence-based best practices and established clinical guidelines. The physician must navigate potential patient resistance to treatment, the complexities of managing a chronic disease, and the need to ensure adherence to a therapeutic regimen that may have side effects or require lifestyle adjustments. This requires not only clinical expertise, but also strong communication and patient education skills. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's current symptoms, a review of their existing treatment plan, and a discussion about potential adjustments based on objective findings and patient feedback. This aligns with the principles of patient-centered care, which is a cornerstone of U.S. healthcare regulations and ethical practice. It emphasizes shared decision-making, where the physician and patient collaborate to determine the best course of action. Furthermore, adherence to established clinical practice guidelines for managing COPD ensures that the patient receives care that is supported by scientific evidence, promoting optimal outcomes and preventing complications. This approach respects the patient's autonomy while ensuring their safety and well-being, consistent with the ethical obligations of physicians under U.S. law and professional standards. Incorrect approaches analysis. One incorrect approach involves immediately increasing the dosage of bronchodilators without a thorough reassessment. This fails to address the potential underlying causes of the patient's worsening symptoms, such as infection, environmental triggers, or non-adherence to medication. It represents a reactive rather than a proactive approach and could lead to overmedication, increased side effects, and a delay in identifying and treating the true cause of the exacerbation. This deviates from the principle of providing appropriate and evidence-based care. Another incorrect approach is to dismiss the patient's concerns about increased shortness of breath as simply anxiety. This invalidates the patient's experience and can lead to a misdiagnosis of a serious underlying issue. Ethically and legally, healthcare providers have a duty to investigate patient complaints thoroughly. Failing to do so can be considered medical negligence and violates the trust inherent in the physician-patient relationship. A third incorrect approach is to focus solely on prescribing new medications without addressing potential lifestyle factors that may be contributing to the patient's respiratory distress, such as smoking cessation or adherence to pulmonary rehabilitation. While medication is important, a holistic approach is often necessary for managing chronic respiratory diseases effectively. Ignoring these factors represents an incomplete assessment and treatment plan, potentially leading to suboptimal outcomes and a failure to meet the patient's comprehensive health needs. Professional reasoning. Professionals should approach such situations by first conducting a thorough and systematic patient assessment. This includes obtaining a detailed history of present illness, reviewing past medical history, current medications, and lifestyle factors. Objective data, such as vital signs, physical examination findings, and relevant diagnostic tests, e.g., spirometry, chest X-ray, arterial blood gas, should be gathered. Following this, the physician should engage in open and honest communication with the patient, explaining the findings and discussing potential treatment options, including their risks and benefits. The decision-making process should be collaborative, respecting the patient's values and preferences, while ensuring that the recommended course of action is medically sound and aligned with current best practices and regulatory requirements for patient care in the United States. Question 9. The risk matrix shows a patient with newly diagnosed hypothyroidism who expresses a strong desire to avoid all thyroid hormone replacement therapy, citing concerns about long-term side effects and a preference for natural approaches. The physician has explained the potential consequences of untreated hypothyroidism, including fatigue, weight gain, cognitive impairment, and increased risk of cardiovascular disease. Which of the following represents the most appropriate next step in managing this patient's care? Option A. Immediately prescribe the lowest effective dose of levothyroxine, explaining that while side effects are possible, the risks of untreated hypothyroidism are far greater and that adherence is non-negotiable for their health. Option B. Engage in a detailed discussion to explore the patient's specific concerns about medication side effects and natural approaches. Offer to discuss alternative management strategies or lifestyle modifications that can complement therapy, and collaboratively develop a shared decision-making plan that addresses their fears while emphasizing the importance of monitoring thyroid function. Option C. Refer the patient to an endocrinologist for a second opinion, stating that the physician is unable to manage a patient who refuses standard medical treatment for a diagnosed condition. Option D. Document the patient's refusal of medication and discharge them from care, as patient autonomy is paramount and the physician cannot force treatment. The correct answer is B. Engage in a detailed discussion to explore the patient's specific concerns about medication side effects and natural approaches. Offer to discuss alternative management strategies or lifestyle modifications that can complement therapy, and collaboratively develop a shared decision-making plan that addresses their fears while emphasizing the importance of monitoring thyroid function. Explanation. This scenario presents a professionally challenging situation due to the need to balance patient autonomy, informed consent, and the physician's duty of care when managing a chronic condition with potentially serious consequences. The patient's expressed desire to avoid medication, despite a diagnosed thyroid disorder, creates a conflict that requires careful navigation. The physician must ensure the patient understands the risks and benefits of treatment and non-treatment, and that any decision made is truly informed. The correct approach represents best professional practice by prioritizing a comprehensive discussion of risks and benefits, exploring the patient's concerns, and collaboratively developing a management plan. This aligns with the ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, and respect for patient autonomy. Specifically, it adheres to the U.S. regulatory framework governing physician-patient relationships, which emphasizes informed consent as a cornerstone of medical practice. This includes providing clear, understandable information about the diagnosis, prognosis, treatment options, including no treatment, and potential complications, allowing the patient to make an autonomous decision. An incorrect approach that focuses solely on immediate patient preference, without adequately addressing the long-term health implications, would represent a failure to uphold the physician's duty of care. This could lead to patient harm due to untreated or undertreated thyroid disease, violating the principle of beneficence. Furthermore, failing to thoroughly explore the patient's reasons for refusing medication and offering alternatives or addressing barriers to adherence could be seen as a failure to respect patient autonomy, as the decision may not be truly informed. Another incorrect approach, such as immediately overriding the patient's wishes and prescribing medication, would be a direct violation of patient autonomy and could erode the trust essential for a therapeutic relationship. This disregards the legal and ethical requirement for informed consent, which is central to U.S. medical practice. The professional decision-making process for similar situations should involve a structured approach. First, thoroughly assess the patient's understanding of their condition and the implications of their choices. Second, actively listen to and validate the patient's concerns and reasons for their preferences. Third, provide clear, unbiased information about all available options, including the risks and benefits of each, using language the patient can understand. Fourth, explore potential barriers to adherence or alternative management strategies that might align with the patient's values. Finally, document the discussion thoroughly and collaboratively, establish a mutually agreed-upon plan, ensuring the patient feels heard and empowered in their healthcare decisions. Question 10. Analysis of a 65-year-old male patient with a new diagnosis of moderate to severe ulcerative colitis, a history of hypertension, and a recent myocardial infarction, who expresses a strong desire to avoid systemic immunosuppression due to fear of infection. The patient is also concerned about the burden of frequent clinic visits and complex medication schedules. What is the most appropriate initial approach for this patient? Option A. Initiate a discussion about the risks and benefits of various treatment modalities for moderate to severe ulcerative colitis, including topical therapies, mesalamine, and potentially immunomodulators or biologics, while also addressing his concerns about infection and treatment burden, and involving his cardiologist in the treatment planning. Option B. Immediately prescribe a high-dose corticosteroid regimen to rapidly control inflammation, deferring discussions about long-term management and patient preferences until the acute episode has resolved. Option C. Refer the patient to a psychiatrist to address his unrealistic fear of infection before initiating any gastrointestinal treatment. Option D. Recommend only lifestyle modifications and dietary changes, as the patient's comorbidities and fear of infection make more aggressive IBD treatment too risky. Correct answer is A. Initiate a discussion about the risks and benefits of various treatment modalities for moderate to severe ulcerative colitis, including topical therapies, mesalamine, and potentially immunomodulators or biologics, while also addressing his concerns about infection and treatment burden, and involving his cardiologist in the treatment planning. Explanation. Scenario analysis. This scenario presents a professionally challenging situation due to the inherent complexity of managing inflammatory bowel disease, IBD, in a patient with multiple comorbidities and a history of non-adherence. The physician must balance aggressive treatment to control active disease with the risks of exacerbating existing conditions and the patient's capacity to manage a complex regimen. The patient's expressed desire for a less intensive approach, while understandable, directly conflicts with the medical necessity of controlling active inflammation to prevent long-term complications. This requires careful communication, shared decision-making, and a thorough understanding of the patient's values and limitations, all within the framework of established medical guidelines and ethical practice. Correct approach analysis. The correct approach prioritizes a comprehensive, multidisciplinary assessment and a shared decision-making process. This aligns with the ethical principles of patient autonomy and beneficence, as well as regulatory expectations for evidence-based care. By involving specialists, gastroenterology, cardiology, infectious disease, the physician ensures all aspects of the patient's health are considered. Discussing treatment options, including risks, benefits, and alternatives, empowers the patient to participate actively in their care plan, fostering adherence and improving outcomes. This approach respects the patient's desire for a less intensive regimen, while ensuring their safety and well-being are paramount. Adhering to the U.S. medical standard of care, which emphasizes patient-centeredness and informed consent. Incorrect approach is analysis. An approach that solely focuses on the patient's expressed preference for a less intensive regimen, without a thorough assessment of the risks and benefits of such a decision, would be ethically and regulatorily flawed. This would violate the principle of beneficence by potentially allowing disease progression and increasing the risk of serious complications. It also fails to adequately inform the patient of the consequences of their choice, undermining informed consent. An approach that unilaterally imposes a highly aggressive treatment plan without engaging the patient in a discussion about their preferences and concerns would violate the principle of patient autonomy. While the physician's medical judgment is crucial, disregarding the patient's input and values can lead to mistrust, non-adherence, and ultimately, poorer outcomes. This also fails to meet the standard of patient-centered care expected in U.S. medical practice. An approach that delays necessary treatment due to the patient's comorbidities without a clear, evidence-based rationale for such a delay would be professionally unacceptable. While comorbidities require careful consideration, active IBD necessitates timely intervention to prevent irreversible damage and systemic complications. This would represent a failure to act in the patient's best interest and could be considered a deviation from the standard of care. Professional reasoning. Professionals should approach such complex cases by first conducting a thorough assessment of the patient's medical condition, including all comorbidities and the severity of the IBD. This should be followed by an open and honest discussion with the patient about their diagnosis, prognosis, and all available treatment options, including their respective risks, benefits, and alternatives. The physician must actively listen to the patient's concerns, values, and preferences, and then collaboratively develop a treatment plan that balances medical necessity with the patient's capacity and desires. This process should involve a multidisciplinary team when appropriate, ensuring all aspects of the patient's care are addressed. Documentation of this shared decision-making process is critical. Question 11. Operational review demonstrates a patient presenting to the emergency department with a sudden onset of fever, severe cough, and shortness of breath, accompanied by a travel history to a region experiencing a known outbreak of a novel respiratory virus. The patient is visibly distressed and exhibits signs of respiratory compromise. What is the most appropriate initial management strategy to address both the patient's immediate clinical needs and the potential public health implications? Option A. Perform a chest X-ray and blood cultures, then proceed with standard inpatient admission protocols without specific isolation measures. Option B. Immediately initiate broad-spectrum intravenous antibiotics and supportive care while awaiting further diagnostic results. Option C. Administer oxygen therapy and analgesics and advise the patient to return if symptoms worsen, pending further outpatient evaluation. Option D. Place the patient in a negative pressure isolation room and notify the hospital's infection control department for immediate consultation and guidance. The correct answer is B. Immediately initiate broad-spectrum intravenous antibiotics and supportive care while awaiting further diagnostic results. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for rapid spread of a highly contagious and potentially severe infectious disease within a healthcare setting. Physician must balance the immediate need to diagnose and treat the patient with the critical responsibility of preventing nosocomial transmission to other patients and healthcare workers. This requires swift, accurate, and evidence-based decision-making under pressure, adhering to established public health guidelines and institutional protocols. Correct approach analysis. The correct approach involves immediate isolation of the patient and notification of the infection control team. This aligns directly with the Centers for Disease Control and Prevention (CDC) guidelines for managing suspected cases of highly infectious diseases. Isolation prevents further transmission by containing the pathogen. Prompt notification ensures that a multidisciplinary team with expertise in infectious diseases and infection control can implement appropriate containment strategies, contact tracing, and diagnostic testing. This proactive measure is ethically mandated to protect the wider patient population and healthcare workforce, fulfilling the physician's duty of care and adherence to public health regulations aimed at preventing epidemics. Incorrect approaches analysis. Implementing empiric broad-spectrum antibiotics without considering isolation and infection control consultation is a failure to adhere to best practices for infectious disease containment. While antibiotic therapy is crucial, it does not address the primary risk of transmission. This approach prioritizes individual treatment over community safety, potentially leading to further spread and complicating subsequent diagnostic efforts. It violates the ethical principle of non-maleficence by failing to adequately protect others from harm. Delaying diagnostic workup and solely relying on symptom management without initiating isolation protocols is a significant regulatory and ethical lapse. This approach neglects the urgent need to identify the causative agent and implement containment measures. It risks exacerbating the outbreak by allowing an infectious individual to remain in a setting where transmission is likely, directly contravening public health mandates and the physician's responsibility to prevent harm. Discharging the patient home without a definitive diagnosis or appropriate public health precautions is a severe breach of professional responsibility and regulatory compliance. This action places the community at high risk of exposure and potential outbreak. It demonstrates a failure to recognize the severity of the situation and to follow established protocols for managing potentially contagious individuals, violating the physician's duty to protect public health. Professional reasoning. Professionals should approach such situations by first prioritizing immediate containment of the potential infectious agent. This involves activating established protocols for isolation and notifying specialized teams. Simultaneously, a thorough diagnostic workup should be initiated to identify the pathogen and guide specific treatment. This systematic approach ensures that patient care is addressed while rigorously safeguarding the health of the broader community, reflecting a commitment to both individual well-being and public health responsibilities, as outlined by regulatory bodies like the CDC and state health departments. Question 12. The audit findings indicate a pattern of delayed or incomplete management of shoulder dislocation in a cohort of patients. Which of the following approaches best reflects the current best practice for the initial evaluation and management of a suspected shoulder dislocation in the United States? Option A. Administering pain medication and advising the patient to return in 1 week for reassessment and potential reduction if symptoms persist. Option B. Prompt neurovascular assessment, appropriate imaging, e.g., X-rays, to confirm the dislocation and rule out associated fractures, followed by reduction and post-reduction neurovascular assessment and imaging. Option C. Relying solely on palpation to confirm the dislocation and proceeding directly to reduction without any imaging. Option D. Immediate reduction of the dislocation using a recognized technique, followed by a brief physical examination and discharge, with instructions for follow-up. The correct answer is D. Immediate reduction of the dislocation using a recognized technique, followed by a brief physical examination and discharge with instructions for follow-up. Explanation. Scenario analysis. This scenario presents a common clinical challenge involving a joint dislocation, specifically a shoulder dislocation, which requires prompt and accurate assessment and management. The audit findings highlight a potential deviation from established best practices, necessitating a review of the diagnostic and therapeutic approaches. The professional challenge lies in ensuring that the patient receives timely and appropriate care, minimizing complications, and adhering to the standards of practice expected within the U.S. healthcare system, as governed by bodies like the Centers for Medicare and Medicaid Services, CMS, and professional medical organizations. Correct approach analysis. The correct approach involves a thorough history and physical examination, including assessment for neurovascular compromise, followed by appropriate imaging to confirm the diagnosis and rule out associated injuries, such as fractures. Reduction of the dislocation should be performed promptly using a recognized technique, followed by post-reduction imaging, and a plan for immobilization and rehabilitation. This aligns with the principles of evidence-based medicine and the standards of care for musculoskeletal injuries in the United States. Adherence to these steps ensures patient safety, optimizes outcomes, and minimizes the risk of complications like recurrent dislocations, nerve damage, or vascular injury, which are critical considerations under U.S. medical practice guidelines. Incorrect approaches analysis. An approach that delays imaging or reduction without a clear clinical indication for such delay would be professionally unacceptable. This could lead to prolonged pain, increased risk of neurovascular compromise, and potential for more complex reduction techniques or complications. Failure to perform a neurovascular assessment before and after reduction is a significant ethical and regulatory failure, as it directly impacts patient safety and could lead to irreversible damage. Similarly, neglecting post-reduction imaging can result in missed associated injuries or an unsuccessful reduction, requiring further intervention and potentially compromising patient care. Relying solely on palpation without appropriate imaging for confirmation, especially in complex cases or when associated injuries are suspected, deviates from accepted diagnostic standards. Professional reasoning. Professionals should approach joint dislocations with a systematic methodology. This begins with a rapid but thorough assessment of the patient's overall condition and the affected joint, prioritizing the identification of any immediate life threats or critical neurovascular deficits. Following this, a detailed history and focused physical examination are crucial. The decision to proceed with imaging should be guided by the clinical suspicion of associated injuries or the complexity of the dislocation. Reduction techniques should be chosen based on the specific joint and dislocation pattern, with careful attention to patient comfort and safety. Post-reduction management, including immobilization, pain control, and a structured rehabilitation plan, is essential for optimal recovery and prevention of future issues. Continuous learning and adherence to updated clinical guidelines are paramount. Question 13. Research into the efficacy of a novel, unproven dietary supplement for managing type 2 diabetes has led a patient to request its inclusion in their treatment plan, alongside their prescribed metformin and lifestyle modifications. The patient expresses strong belief in the supplement's purported benefits, citing anecdotal evidence from online sources. As the endocrinologist responsible for the patient's care, what is the most appropriate course of action? Option A. Agree to incorporate the unproven supplement into the treatment plan, but advise the patient to continue metformin and lifestyle modifications without explicitly detailing the risks and benefits of the supplement itself. Option B. Thoroughly discuss the current scientific evidence regarding the supplement's efficacy and safety. Explain the established benefits and risks of metformin and lifestyle modifications, and collaboratively develop a treatment plan that prioritizes evidence-based interventions while addressing the patient's concerns. Option C. Inform the patient that their request is based on unsubstantiated claims and dismiss the supplement from consideration without further discussion, focusing solely on standard treatments. Option D. Immediately prescribe the unproven dietary supplement as requested by the patient to respect their autonomy and maintain a positive patient relationship. Correct answer is B. Thoroughly discuss the current scientific evidence regarding the supplement's efficacy and safety. Explain the established benefits and risks of metformin and lifestyle modifications, and collaboratively develop a treatment plan that prioritizes evidence-based intervention while addressing the patient's concerns. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a patient's desire for a specific treatment and the physician's ethical and professional obligation to provide evidence-based care. The physician must navigate the patient's autonomy while upholding the principles of beneficence and non-maleficence, particularly when the requested treatment lacks robust scientific support and carries potential risks. The physician's responsibility extends to educating the patient about the risks and benefits of all available options, including standard of care treatments. Correct approach analysis. The correct approach represents best professional practice by prioritizing patient safety and evidence-based medicine, aligning with the core tenets of medical ethics and the regulatory framework governing physician conduct in the United States. The physician's duty is to provide informed consent, which necessitates a thorough discussion of all treatment options, including their efficacy, risks, and benefits, supported by scientific evidence. Recommending a treatment that is not supported by current medical literature or is considered experimental without proper justification and informed consent would violate these principles. The physician must guide the patient towards treatments that have demonstrated efficacy and safety, adhering to established clinical guidelines and the standards of care. This approach upholds the physician's role as a trusted advisor and protector of the patient's well-being, as mandated by professional medical organizations and state medical boards. Incorrect approach is analysis. An incorrect approach that involves immediately agreeing to the patient's request without a thorough evaluation of the proposed treatment's scientific validity and potential risks would be a significant ethical and regulatory failure. This disregards the physician's responsibility to practice evidence-based medicine and could lead to patient harm, violating the principle of non-maleficence. It also fails to adequately inform the patient, undermining the process of informed consent. Another incorrect approach would be to dismiss the patient's request outright without engaging in a respectful dialogue or exploring the underlying reasons for their preference. This demonstrates a lack of empathy and disrespect for patient autonomy, potentially damaging the physician-patient relationship and failing to address the patient's concerns comprehensively. It also misses an opportunity to educate the patient about evidence-based alternatives. A third incorrect approach might involve prescribing the unproven treatment alongside standard therapy without clearly delineating the risks and benefits of each, or without a clear plan for monitoring the efficacy and safety of the unproven treatment. This can lead to confusion for the patient, make it difficult to assess treatment effectiveness, and potentially expose the patient to unnecessary risks without a clear benefit. This approach fails to meet the rigorous standards of informed consent and responsible medical practice. Professional reasoning. Professionals should approach such situations by first actively listening to and understanding the patient's concerns and motivations behind their treatment preference. This should be followed by a comprehensive review of the available scientific literature regarding the proposed treatment. The physician must then engage in a transparent and detailed discussion with the patient, outlining the evidence for and against the proposed treatment, as well as discussing established, evidence-based treatment options. The decision-making process should be collaborative, ensuring the patient's autonomy is respected while guiding them towards the safest and most effective course of action, consistent with professional ethical guidelines and regulatory requirements for informed consent and standard of care. Question 14. The performance metrics show a pattern of delayed diagnosis in patients presenting with acute limb pain following trauma, particularly when initial physical examination findings are equivocal. A 45-year-old male presents to the emergency department after a fall from a standing height, complaining of right wrist pain. He reports immediate pain and swelling, but denies any gross deformity or inability to move his fingers. On examination, there is mild tenderness and swelling over the distal radius, with full passive range of motion of the fingers. Given the potential for occult fracture, which of the following diagnostic approaches is most appropriate to ensure optimal patient care and adherence to U.S. medical standards? Option A. Discharge the patient with instructions for rest and ice and to follow up with primary care in 1 week. Option B. Rely on the patient's subjective pain intensity to guide further investigation. Option C. Initiate conservative management with splinting and advise return if pain significantly worsens. Option D. Obtain a plain radiograph of the right wrist. The correct answer is D. Obtain a plain radiograph of the right wrist. Explanation. Scenario analysis. This scenario presents a professionally challenging situation due to the potential for delayed diagnosis and subsequent complications arising from a fracture. The challenge lies in balancing the need for prompt and accurate assessment with the patient's subjective reporting and the limitations of initial physical examination. A failure to adequately assess the risk of occult fracture can lead to significant patient harm, including chronic pain, functional impairment, and increased treatment complexity. The physician must exercise careful judgment to differentiate between minor soft tissue injuries and potentially serious fractures that require immediate orthopedic intervention. Correct approach analysis. The correct approach of obtaining a plain radiograph of the affected limb is the cornerstone of fracture diagnosis in the United States medical system. This aligns with established clinical guidelines and the standard of care for suspected fractures. Radiographs provide objective evidence of bony disruption, allowing for accurate diagnosis, appropriate management, e.g., reduction, immobilization, and timely referral to orthopedic specialists if necessary. This approach prioritizes patient safety and adherence to best practices in musculoskeletal injury assessment, as mandated by the principles of evidence-based medicine that underpin U.S. medical practice. Incorrect approach is analysis, proceeding with conservative management without imaging, despite persistent pain and suspicion of fracture, represents a failure to adhere to diagnostic best practices. This could lead to delayed treatment, non-union, malunion, or the development of post-traumatic arthritis, all of which are preventable with timely diagnosis. Ethically, this approach risks violating the principle of beneficence by not acting in the patient's best interest to achieve the optimal outcome. Relying solely on the patient's description of pain intensity to rule out a fracture is an insufficient diagnostic strategy. Pain is subjective and can be misleading. Fractures can occur with varying degrees of pain, and some significant fractures may present with less severe pain than certain soft tissue injuries. This approach neglects the objective diagnostic tools available and could lead to a misdiagnosis, failing to meet the standard of care, discharging the patient with advice to return only if symptoms worsen significantly without a definitive diagnostic step. Imaging is a critical failure. This places an undue burden on the patient to self-monitor for potentially serious complications and delays necessary intervention. It deviates from the proactive diagnostic approach expected in U.S. healthcare, where timely and thorough evaluation is paramount to prevent adverse outcomes. Professional reasoning. In situations involving suspected fractures, the professional decision-making process should prioritize a systematic and evidence-based approach. This involves 1. A thorough history and physical examination to identify signs and symptoms suggestive of fracture. 2. Consideration of the mechanism of injury. 3. Utilization of appropriate diagnostic imaging, radiographs being the initial modality of choice for most suspected fractures in the U.S. 4. Based on diagnostic findings, initiating appropriate management or referral. This structured approach ensures that patient care is guided by objective data and established medical protocols, minimizing the risk of diagnostic error and ensuring optimal patient outcomes within the U.S. regulatory and ethical framework. Question 15. Process analysis reveals a 65-year-old male patient with a history of diverticulitis presents with a new episode of severe abdominal pain and fever. Imaging confirms a perforated sigmoid colon with localized peritonitis. The surgical team recommends an emergent sigmoid colectomy with primary anastomosis and loop ileostomy. The patient, after a thorough discussion of the risks, benefits, and alternatives, including the potential for sepsis and death if left untreated, explicitly refuses the surgery, stating he wishes to pursue conservative management with antibiotics and bowel rest. He appears lucid and understands the gravity of his condition. What is the most appropriate next step for the surgical team? Option A. Document the patient's refusal of surgery and the informed consent discussion. Continue with conservative management as requested, and arrange for close monitoring and follow-up. Option B. Immediately transfer the patient to another facility that is willing to perform the surgery, without further discussion or attempts to understand his reasoning. Option C. Proceed with the emergent sigmoid colectomy, explaining to the patient that it is medically necessary and his refusal cannot be honored in this critical situation. Option D. Attempt to persuade the patient's family to convince him to undergo the surgery, overriding his personal wishes. The correct answer is A. Document the patient's refusal of surgery and the informed consent discussion, continue with conservative management as requested, and arrange for close monitoring and follow-up. Explanation. Scenario analysis. This scenario presents a conflict between a patient's autonomy and a surgeon's professional judgment regarding the necessity and potential risks of a recommended surgical intervention. The patient, despite being informed of the risks and benefits, is refusing a procedure that the surgeon believes is medically indicated to prevent a potentially life-threatening complication. This creates a challenging ethical and professional dilemma, requiring careful consideration of patient rights, physician responsibility, and the principles of informed consent and beneficence. Correct approach analysis. The correct approach involves respecting the patient's informed decision-making capacity while continuing to educate and explore alternatives. This aligns with the core ethical principle of patient autonomy, which dictates that competent adults have the right to make decisions about their own medical care, even if those decisions seem contrary to medical advice. In the U.S. healthcare system, this is further reinforced by legal precedents and professional guidelines emphasizing informed consent. The surgeon's responsibility is to ensure the patient has received comprehensive information, understands the implications of their decision, and is not being coerced. Continuing the dialogue, exploring the patient's reasoning, and offering further consultations or second opinions are crucial steps in upholding this principle and ensuring the patient's decision is truly informed. Incorrect approaches analysis. One incorrect approach is to proceed with the surgery against the patient's explicit refusal. This violates the principle of patient autonomy and constitutes battery, a legal and ethical transgression. It disregards the patient's right to self-determination and can erode trust in the physician-patient relationship. Another incorrect approach is to abandon the patient without ensuring continuity of care or exploring all avenues to support their decision-making. While respecting the refusal, a physician still has a duty of care to a patient. Simply walking away without further discussion or referral would be a dereliction of this duty, potentially leaving the patient vulnerable. A third incorrect approach is to coerce or unduly influence the patient into accepting the surgery. This undermines the integrity of the informed consent process. While advocating for a particular treatment is part of a physician's role, it must not cross the line into manipulation or pressure, which negates the voluntariness required for valid consent. Professional reasoning. Professionals facing such dilemmas should employ a structured decision-making process. First, assess the patient's decision-making capacity. If capacity is intact, engage in thorough, empathetic communication to understand the patient's concerns and values. Clearly articulate the medical rationale for the recommended treatment and the potential consequences of refusal. Document all discussions meticulously. Explore all reasonable alternatives and offer support, including second opinions or palliative care if appropriate. If the patient remains steadfast in their informed refusal, the physician must respect that decision, while ensuring appropriate follow-up and care planning. Question 16. Which approach would be most appropriate for initiating the management of a 45-year-old patient presenting with daily heartburn and regurgitation for the past 3 months, with no alarm symptoms such as dysphagia, odynophagia, unintentional weight loss, or evidence of gastrointestinal bleeding? Option A. Prescribe a histamine 2 receptor antagonist for symptom relief and schedule a follow-up appointment in 2 months. Option B. Refer the patient for an urgent upper endoscopy to evaluate for esophagitis and other potential causes. Option C. Initiate empirical treatment with a proton pump inhibitor and reassess symptom response in 4 weeks. Option D. Advise the patient to implement strict dietary modifications and elevate the head of their bed without pharmacological intervention. The correct answer is C. Initiate empirical treatment with a proton pump inhibitor and reassess symptom response in 4 weeks. Explanation. This scenario presents a professionally challenging situation because it requires balancing the patient's subjective symptoms with objective diagnostic findings to determine the most appropriate and cost-effective management strategy for gastroesophageal reflux disease, GERD. The challenge lies in avoiding unnecessary interventions while ensuring adequate symptom control and preventing long-term complications. Careful judgment is required to tailor the diagnostic and treatment plan to the individual patient's presentation and risk factors, adhering to established clinical guidelines and ethical principles of patient care. The correct approach represents best professional practice because it prioritizes a stepwise, evidence-based strategy that aligns with current U.S. medical guidelines for GERD management. This approach begins with empirical treatment with proton pump inhibitors, PPI, for patients with typical GERD symptoms and no alarm features. This is a cost-effective initial step that often resolves symptoms and avoids the need for more invasive or expensive investigations. If symptoms persist or recur despite adequate PPI therapy, then further investigation, such as upper endoscopy, is warranted to rule out complications like erosive esophagitis, Barrett's esophagus, or malignancy, and to confirm the diagnosis. This systematic approach ensures that resources are used judiciously and that patients receive appropriate care without undue delay or unnecessary procedures. It reflects the ethical obligation to provide competent and efficient care. An incorrect approach that involves immediate referral for upper endoscopy without a trial of empirical PPI therapy is professionally unacceptable. This fails to adhere to the principle of judicious resource utilization and may subject the patient to unnecessary risks and costs associated with an invasive procedure. It also bypasses a well-established and often effective first-line treatment strategy, potentially leading to patient dissatisfaction and increased healthcare expenditure without clear clinical benefit. This approach could be seen as a failure to practice evidence-based medicine and may violate ethical considerations regarding patient welfare and resource stewardship. Another incorrect approach, such as solely relying on lifestyle modifications without considering pharmacological intervention for moderate to severe symptoms, is also professionally problematic. While lifestyle changes are important adjuncts, they are often insufficient as monotherapy for significant GERD, leading to continued patient suffering and potential progression of disease. This approach neglects the established efficacy of PPIs in managing GERD symptoms and could be considered a failure to provide adequate medical care, potentially impacting patient quality of life and adherence to treatment. A further incorrect approach, such as prescribing long-term PPIs without periodic reassessment or consideration of step-down therapy or alternative management strategies, is also professionally questionable. While PPIs are generally safe, long-term use can be associated with potential side effects and may mask underlying conditions. Best practice involves ongoing evaluation of treatment effectiveness, exploration of de-escalation options, and consideration of other therapeutic modalities when appropriate, aligning with the principle of providing individualized and dynamic patient care. The professional decision-making process for similar situations should involve a thorough patient history, including symptom characteristics, duration, severity, and presence of alarm features. This should be followed by an assessment of risk factors and comorbidities. Based on this evaluation, a stepwise approach to diagnosis and management should be implemented, starting with the least invasive and most cost-effective interventions. Regular reassessment of treatment efficacy and patient response is crucial, with escalation of diagnostic or therapeutic interventions as indicated by clinical findings and patient progress. Adherence to established clinical guidelines and ethical principles of beneficence, non-maleficence, and justice should guide all decisions. Question 17. The review process indicates that a 68-year-old male patient with established osteoarthritis of the knees has consistently reported minimal improvement in pain and function, despite adhering to his prescribed regimen of acetaminophen, topical NSAID, and regular low-impact exercise. During his follow-up appointment, he expresses frustration and states, "I'm doing what you told me, but it's just not helping enough." What is the most appropriate next step for the physician to take? Option A. Reiterate the importance of the current treatment plan and strongly encourage the patient to continue with acetaminophen, topical NSAID, and exercise, emphasizing that these are the standard of care. Option B. Advise the patient that osteoarthritis is a progressive condition and that his current level of discomfort is to be expected, suggesting he simply learn to live with the pain. Option C. Immediately prescribe oral corticosteroids for a short course to address the patient's reported lack of improvement. Option D. Explore the patient's specific experiences with the current treatment regimen, identify potential barriers to adherence or efficacy, and collaboratively discuss alternative or adjunctive therapeutic options. Correct answer is D. Explore the patient's specific experiences with the current treatment regimen, identify potential barriers to adherence or efficacy, and collaboratively discuss alternative or adjunctive therapeutic options. Explanation. This scenario presents a common challenge in managing chronic conditions like osteoarthritis, where patient adherence to treatment plans is crucial for optimal outcomes. The professional challenge lies in balancing the physician's responsibility to provide evidence-based care with the patient's autonomy and individual circumstances. A physician must consider not only the efficacy of a treatment, but also its practicality and acceptability to the patient, ensuring informed consent and shared decision-making. The correct approach represents best professional practice because it prioritizes a comprehensive, patient-centered assessment. This involves understanding the patient's perspective, identifying barriers to adherence, and collaboratively developing a revised treatment plan. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and autonomy, respecting the patient's right to make decisions about their care. Furthermore, it adheres to the U.S. regulatory framework governing physician-patient relationships, which emphasizes communication, shared decision-making, and the development of individualized care plans. This approach ensures that the treatment plan is not only medically sound, but also sustainable and effective for the individual patient. An incorrect approach that focuses solely on reinforcing the existing treatment plan without exploring the patient's reasons for non-adherence fails to address the root cause of the problem. This could lead to continued suboptimal outcomes and potentially patient dissatisfaction, violating the principle of beneficence. Ethically, it neglects the patient's autonomy by not actively seeking their input or understanding their challenges. From a regulatory standpoint, it may fall short of the communication standards expected in patient care, potentially leading to a breakdown in the therapeutic relationship. Another incorrect approach, such as immediately escalating to more aggressive or invasive treatments without a thorough understanding of the current treatment's failure, is premature and potentially harmful. This disregards the need for a systematic, stepwise approach to managing osteoarthritis and could lead to unnecessary risks and costs for the patient. It fails to uphold the principle of non-maleficence, do no harm, and may not be supported by evidence-based guidelines for initial management. A third incorrect approach, such as dismissing the patient's concerns and attributing non-adherence solely to patient noncompliance, is dismissive and unprofessional. This fosters a paternalistic model of care, undermining the patient's role in their own health management. It neglects the physician's responsibility to investigate potential issues with the treatment regimen itself, such as side effects, cost, or complexity, which are common reasons for non-adherence. This approach can damage the physician-patient relationship and hinder effective care. A professional decision-making process for similar situations should involve active listening to the patient's concerns, a thorough assessment of potential barriers to adherence, including understanding the patient's daily routine, beliefs about treatment, and any financial or logistical challenges, and collaborative problem-solving. This iterative process ensures that treatment plans are dynamic and responsive to the patient's evolving needs and circumstances, fostering a strong therapeutic alliance and promoting better health outcomes within the U.S. healthcare system's regulatory and ethical guidelines. Question 18. The analysis reveals a 68-year-old male with a 40-pack-year smoking history presenting with increasing dyspnea, frequent productive cough, and 2 hospitalizations for COPD exacerbations in the past year, despite consistent use of a combination inhaled corticosteroid and long-acting beta agonist. His current regimen includes twice-daily use of his inhaler, and he denies missing doses. Which of the following is the most appropriate next step in optimizing his management? Option A. Advise the patient to reduce his physical activity to conserve energy. Option B. Refer the patient for immediate lung transplantation evaluation. Option C. Assess inhaler technique, review adherence, investigate for alpha-1 antitrypsin deficiency, and consider adding a long-acting muscarinic antagonist. Option D. Increase the dose of the current inhaled corticosteroid and long-acting beta agonist combination. The correct answer is C. Assess inhaler technique, review adherence, investigate for alpha-1 antitrypsin deficiency, and consider adding a long-acting muscarinic antagonist. Explanation. Scenario analysis. This scenario presents a common challenge in managing chronic obstructive pulmonary disease, COPD, where a patient's symptoms are not adequately controlled despite adherence to prescribed inhaled therapies. The professional challenge lies in accurately assessing the contributing factors to the patient's persistent exacerbations and functional limitations, and then implementing an evidence-based, patient-centered management plan that aligns with current clinical guidelines and regulatory expectations for quality patient care. This requires a comprehensive understanding of COPD pathophysiology, treatment options, and the importance of shared decision-making. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's current treatment regimen, including technique, adherence, and the appropriateness of the prescribed medications for their disease severity and phenotype. It also necessitates exploring modifiable risk factors such as smoking cessation, vaccination status, and pulmonary rehabilitation. This aligns with the U.S. regulatory framework's emphasis on evidence-based medicine, patient safety, and the provision of high-quality care as outlined by organizations like the Centers for Medicare and Medicaid Services, CMS, and professional bodies such as the American Thoracic Society (ATS) and the European Respiratory Society (ERS) in their COPD guidelines. The approach prioritizes a holistic assessment and the implementation of interventions proven to improve outcomes, reflecting a commitment to patient well-being and adherence to best practices. Incorrect approach is analysis, an approach that solely focuses on increasing the dose of inhaled corticosteroids without a thorough reassessment of inhaler technique, adherence, or other contributing factors is problematic. This could lead to unnecessary side effects and does not address the root cause of the persistent exacerbations, potentially violating the principle of providing appropriate and individualized care. May also represent a failure to adhere to guidelines that advocate for a stepwise approach to COPD management. Another incorrect approach would be to dismiss the patient's symptoms as simply part of the disease progression without further investigation. This neglects the professional responsibility to actively manage chronic conditions and improve quality of life. It could be seen as a failure to meet the standard of care expected in managing a progressive disease like COPD, potentially leading to preventable declines in lung function and increased healthcare utilization. Finally, an approach that does not involve patient education and shared decision-making regarding treatment adjustments or lifestyle modifications is suboptimal. The U.S. regulatory framework emphasizes patient engagement and informed consent. Failing to involve the patient in the decision-making process undermines their autonomy and can negatively impact adherence and overall treatment success. Professional reasoning. Professionals managing patients with COPD should adopt a systematic and evidence-based approach. This involves 1. Thoroughly assessing the patient's current clinical status, including symptom burden, exacerbation history, and functional limitations. 2. Evaluating adherence to and technique with current therapies. 3. Identifying and addressing modifiable risk factors. 4. Considering guideline-recommended pharmacological and non-pharmacological interventions based on the patient's phenotype and severity. 5. Engaging in shared decision-making with the patient to develop a personalized management plan. This structured process ensures that care is tailored, effective, and compliant with professional and regulatory standards. Question 19. Market research demonstrates that patients increasingly access health information online, sometimes leading to adherence to unproven or potentially harmful therapies. A patient with newly diagnosed hypertension expresses strong interest in a specific dietary supplement regimen they found online, believing it to be a superior alternative to prescribed medication. The physician needs to address this situation effectively. Which of the following represents the most appropriate initial approach? Option A. Immediately dismiss the patient's online research as unreliable and firmly insist on initiating the prescribed antihypertensive medication, emphasizing that the physician's recommendation is the only valid course of action. Option B. Acknowledge the patient's research and concerns, then provide clear, evidence-based information about the risks and benefits of both prescribed medications and the proposed supplement regimen, facilitating a discussion about the safest and most effective treatment plan. Option C. Agree to the patient's request to try the dietary supplement regimen exclusively, without offering further medical advice or discussing the potential risks of foregoing conventional treatment. Option D. Present the patient with a comprehensive review of all available scientific literature on hypertension treatment, including complex statistical analyses, without specifically addressing the patient's online findings or their preferred supplement. The correct answer is B. Acknowledge the patient's research and concerns, then provide clear, evidence-based information about the risks and benefits of both prescribed medications and the proposed supplement regimen, facilitating a discussion about the safest and most effective treatment plan. Explanation. This scenario is professionally challenging because it requires balancing a physician's duty to provide evidence-based care with a patient's autonomy and potential susceptibility to misinformation. The physician must navigate the ethical imperative to inform and guide the patient while respecting their right to make decisions, even if those decisions are not aligned with conventional medical advice. The core of the challenge lies in ensuring informed consent is truly informed, especially when the patient's information sources may be unreliable or biased. The correct approach represents best professional practice because it prioritizes patient well-being through a comprehensive and empathetic engagement. By actively listening to the patient's concerns, acknowledging their research, and then providing clear, evidence-based information, the physician fosters a collaborative decision-making process. This approach aligns with the ethical principles of beneficence, acting in the patient's best interest, and respect for autonomy. Specifically, under U.S. medical ethics and regulatory frameworks governing physician-patient relationships, physicians are obligated to provide accurate information, explain risks and benefits, and ensure patients understand their treatment options. This method directly addresses potential misinformation by offering a trusted, professional counterpoint grounded in scientific consensus, thereby strengthening the foundation for informed consent. An incorrect approach that involves dismissing the patient's research and immediately insisting on a standard treatment plan fails to respect patient autonomy. This can lead to a breakdown in the physician-patient relationship, potentially causing the patient to seek care elsewhere or to distrust medical professionals altogether, which is detrimental to their long-term health. Ethically, this approach violates the principle of respect for persons by not engaging with the patient's perspective. Another incorrect approach, which involves passively accepting the patient's chosen treatment without further discussion or offering alternatives, neglects the physician's duty of beneficence. While respecting autonomy, this approach fails to ensure the patient is making the safest and most effective choice, potentially exposing them to harm if their chosen treatment is ineffective or dangerous. This could be seen as a failure to uphold professional standards of care. A further incorrect approach, which involves overwhelming the patient with complex medical jargon and statistics without addressing their specific concerns or understanding their level of comprehension, can lead to confusion rather than informed consent. This can inadvertently disempower the patient and make them feel less capable of participating in their own care, undermining the goal of shared decision-making. The professional decision-making process for similar situations should involve a structured approach. First, actively listen to and validate the patient's concerns and information sources. Second, assess the patient's understanding and the potential impact of their chosen course of action. Third, provide clear, concise, and evidence-based information, explaining risks, benefits, and alternatives in an understandable manner. Fourth, engage in a shared decision-making dialogue, allowing the patient to ask questions and express their preferences. Finally, document the discussion and the agreed-upon plan, ensuring the patient feels heard and respected throughout the process. Question 20. Risk assessment procedures indicate a 65-year-old male with a history of recent hospitalization for pneumonia and a known colonization with methicillin-resistant Staphylococcus aureus, MRSA, present with fever, elevated white blood cell count, and signs of sepsis. He has a new infiltrate on chest X-ray. Given the patient's risk factors for multi-drug-resistant organisms, MDRO, and the severity of his presentation, which of the following initial management strategies is most appropriate? Option A. Initiate empiric broad-spectrum antibiotics with coverage for MRSA and gram-negative organisms and obtain blood and sputum cultures. Option B. Prescribe antibiotics based on the patient's previous successful pneumonia treatment regimen without obtaining new cultures. Option C. Delay antibiotic administration until definitive culture and sensitivity results are available to ensure targeted therapy. Option D. Administer narrow-spectrum antibiotics targeting common community-acquired pneumonia pathogens and await culture results. The correct answer is A. Initiate empiric broad-spectrum antibiotics with coverage for MRSA and gram-negative organisms and obtain blood and sputum cultures. Explanation. Scenario analysis. This scenario presents a common yet complex challenge in clinical practice. Managing a patient with a suspected multi-drug-resistant organism, MDRO, infection in the context of limited diagnostic information and potential for rapid patient deterioration. The professional challenge lies in balancing the need for prompt, effective treatment with the imperative to avoid unnecessary or inappropriate antibiotic use, which contributes to further resistance. The physician must critically evaluate available data, consider patient-specific factors, and adhere to established guidelines for antimicrobial stewardship. Correct approach analysis. The correct approach involves initiating empiric broad-spectrum antibiotics that cover likely pathogens, including MDRO, while simultaneously obtaining appropriate cultures and diagnostic tests to guide de-escalation or targeted therapy. This strategy aligns with U.S. regulatory frameworks and guidelines, such as those promoted by the Centers for Disease Control and Prevention, CDC, and the Infectious Diseases Society of America, IDSA, which emphasize the importance of timely empiric therapy for severe infections and the subsequent need for pathogen-specific treatment based on culture results. This approach prioritizes patient safety by addressing the immediate threat of infection, while also adhering to antimicrobial stewardship principles by planning for de-escalation. Incorrect approaches analysis. Initiating narrow-spectrum antibiotics without considering the possibility of MDRO is a significant regulatory and ethical failure. This approach neglects the patient's risk factors for MDRO and the potential for treatment failure, which could lead to worsened morbidity and mortality. It contravenes the principle of providing appropriate care and could be seen as a deviation from accepted medical standards. Delaying antibiotic administration until definitive culture and sensitivity results are available especially in a critically ill patient with suspected sepsis, is another critical failure. While awaiting definitive data is ideal for targeted therapy, prolonged delays in empiric treatment for severe infections are associated with increased mortality. This approach prioritizes diagnostic certainty over immediate patient well-being, potentially violating the physician's duty to act in the patient's best interest. Choosing an antibiotic regimen that is known to be ineffective against the most probable MDRO based on local resistance patterns, even if it is broad-spectrum, represents a failure in clinical judgment and adherence to evidence-based practice. This could stem from a lack of awareness of current antibiograms or a misinterpretation of the patient's risk factors, leading to suboptimal treatment and potential for resistance development. Professional reasoning. Professionals should approach such situations by first conducting a rapid risk assessment for MDRO based on patient history, e.g., recent hospitalizations, prior MDRO infections, travel, local epidemiology, and the severity of illness. This assessment should guide the selection of empiric antibiotic therapy. Concurrently, obtaining appropriate cultures, blood, urine, sputum, wound, before initiating antibiotics is crucial for subsequent pathogen identification and susceptibility testing. The treatment plan should include a strategy for reassessment and potential de-escalation of therapy once culture results are available, aligning with antimicrobial stewardship principles. This systematic approach ensures patient safety, optimizes resource utilization, and combats the growing threat of antibiotic resistance.